Here. Perfect. I'll come back. We'll get the recording going on this end. Perfect. Hello, everybody. I'm Dr. Jordan Leasure, reporting to you live from the office. Remember that the camera adds 10 pounds. I am here with my friend Demi. We are talking bone health. We are talking resistance exercises from home. And I will let you kick us off. So go for it, girl.
Well, thank you everybody who's joining or going to watch this again as a replay, because we know it's Memorial Day weekend, but we did not want to skip a beat and hang out with you this week. As Jordan just said, she's going to talk about some resistance exercises for you guys to do at home. As you know, if you do come to Osteostrong, we do suggest that this doesn't replace exercise and that you still do some sort of exercise outside of Osteostrong. So one thing I just wanted to touch on that's Osteostrong related that I don't think I've talked about yet somehow are the Normatec compression boots that we offer. And I thought today that was pretty complimentary because it is something that you can use to recover. So it's a little complimentary to what Jordan's going to talk about and how and why we have them at the center. So as you know, when you come in, or if you don't know, they are a modality that we offer. We do have them at both centers, Schaumburg and Wilmette. Many of our members really like them. They feel like their whole point is to pulse and compress your leg. I call them boots. They cover from your feet all the way up your entire leg. And they're really good to help release tension, improve your blood flow, lymphatic drainage, which helps with your immune system, which we all really care about right now. And I just recently had a member come in this week saying her ankle was bothering her. It felt really tight. She did the boots and it helped relieve a lot of that pressure in her ankle, and she was feeling a lot better. So one of the reasons that we have them, especially for Osteostrong, is that it helps to maximize recovery after your osteogenic loading sessions. So if you come into Osteostrong, you know that especially with the legs, you're using them a lot for the lower growth trigger, and even in the postural, it's using a lot of like your leg bones and everything there. So it's great to use them there. And outside of Osteostrong and as far as like health and wellness benefits, these boots are also great to help increase your flexibility and acute range of motion, which is also why it helps our member with her ankle. And it also helps to accelerate and enhance your recovery by reducing muscle tenderness and pressure. So it's helping relieve some of that pressure so you don't have much pain even after exercise and Osteostrong, and it helps to increase your blood flow, which helps reduce muscle soreness. So even if you exercise a lot and do these exercises that Jordan is going to share with you today, these are a great addition to help your recovery. And they also enhance recovery by reducing your risk of muscle damage. So we have these in addition to your Osteostrong session. They're really great. They have different levels as to how tight they squeeze you, and we let you use them for 10 minutes. So now I will pass it on to Jordan to share some exercises that hopefully you can do at home and see this later and try to make it a part of your routine.
We are going to be doing, and I am going to be doing exercises. I'm going to try to take a look at Facebook. So if you're watching live and have questions and I don't get to you, please know that both Demi and I will be checking this after, and we're happy to answer questions. And if you're watching the replay and you have a question about an exercise, if it's appropriate for you, please, as always, speak with your physician directly before starting or stopping any sort of physical activity or adding an adjunct in something that you haven't already been doing. And also Demi and I, of course, are available after to consult if these would be appropriate for complementing the activities that you're already doing with Osteostrong. So as you can see, I have a handful of equipment laid out. And for those of you that don't know, I am Dr. Jordan Leasure. I am a chiropractor by education. I also have an emphasis in functional medicine. So that's why, I mean, I've been talking so much about all of the different things you can be doing to decrease inflammation, to help with bone growth and bone strength. Maintaining that is always easier than trying to get it back. So that's some of what we're going to do today with the exercises. Of course, with the stay-at-home order, unfortunately, if you do not already have things like weights, hand weights at home, if you do not have, you know, these are weighted balls that we use in the office. And then of course, a lot of what I'm going to show today is with different bands. If you do not already have this equipment, I would strongly suggest that you either do your research prior to purchasing, or you find something at home that is the equivalent. Because unfortunately, with the state of the world right now, people are really price gouging this sort of equipment. I tried to buy some for the office, and under normal circumstances, you can purchase it at about $1 a pound. So this 2-pound weight, or a set of these 2-pound weights, should average like let's say about $5. And I tried to buy one online and it was like $25. And I think that's crazy. So I'm gonna show you a couple of things that you can do if you are trying to follow along today. I'm gonna be going through this rather quickly because we do have a limited amount of time. You can always go back, again, watch the replay. When you're doing these at home, it's about quality, it's not about quantity. You want to really be watching the position that you're doing these things in. That's much more important than getting through all of the sets and all of the reps that I recommend. If you have a pad of paper and you're keeping track, or you're keeping notes on how to do these or how many to do, an easy recommendation is to do 3 sets of 10. And if you feel like you get through about half that, and you know you're starting to feel it, you're feeling winded, then you can take a break and you can finish. You can always separate those and do some in the morning and some in the evening. Again, it's about quality, it's about positioning. That's way more important than getting through all of them. Your body is amazing and your body will make sure that you get through them. It just might not be in a good way, and you could be causing more harm than good. So let's make sure that we keep our positioning correct, and get those couple perfect is better than getting a whole bunch not so great. So what I would like everybody to do, if you do not have, you know, anybody that's been in physical therapy is probably familiar with these bands. They come in a variety of colors. The only color I don't have out right now is red. And the majority of the companies follow a very similar color protocol. Color has to do with resistance. So the yellow, and I don't know if you can tell, but the yellow is very thin. The yellow is going to be our lightest. If you're starting out, if you have not done any of these at home, I would always suggest you start with yellow. Yellow is going to be our lightest. And if you can see this black, it's a lot thicker. Black is the hardest. Black is going to be the most resistance. And then in between, you're going to have the red, which I don't have out. You're going to have green, and then blue, and then black. So if you're trying to remember what your color means at home, that's what it means. They can be used just like this, where they're completely open. They can also be tied together for a few of the exercises we're going to do. You want to make a little loop. You want to make sure that if you're tying a knot, that's why I often recommend people have multiple ones, because if you're tying a knot, you want that knot to be strong. Ours maybe could be a little stronger, because you don't want this unraveling while you're working out. That will hurt. These are stretchy, but they do snap back. So be very careful as you're using them. If you're doing any activity where you're pulling towards yourself, you know, let's say that you tie this around your door handle, which I may suggest that you do. Again, please make sure those knots are nice and strong. Please make sure that your door is closed and maybe locked if you're going to be using that as your point of traction. Also, make sure other people in the house are aware that you're doing these activities. And that may sound kind of funny, but believe me, I've had people working out and they're pulling and somebody opens the door. So you want to be real careful with the setup that you have going on, that everybody knows, everybody in the house is on board. So that's a little bit about what's going on with the bands. These weighted balls that we use, if you don't have anything at home similar to this, you can use cans from, canned foods. If you've got some green beans or some other canned foods in the pantry, you can always use canned foods for some of these exercises. If you're getting really ambitious and you have a gallon of milk, which you shouldn't, because you know how I feel about dairy, but if you have a gallon of milk at home, you can of course use that. And that of course is going to be much heavier than some of these other activities, some of these other options. You can always just use body weight. So some of these that we're going to go through, the point is to make sure that if you're using your muscle, you're actually engaging it. And I can engage my muscle with no weight. So I have nothing here and I'm flexing, I'm engaging my muscle. Or I could have a heavy weight. What do we got here? 5 pounds. And I can not engage my muscle. So I'm just using a little bit of momentum here, and you can see my whole body moving, versus if I have no weight and I'm really flexing and I'm really engaging there. So I'm doing more work right now in my bicep than I was with that weight before. So that's some easy things. If you have nothing at home, you can still work out. So let's get started. Again, please speak with your doctor before adding any of these in. And the other equipment that we have, and some of you may actually have these laying around if you were working out in the 80s. So these are ankle weights, and really they can be strapped anywhere on the body. The ones that we have are 2 pounds. So again, I can either utilize these in that capacity. I can strap them to my ankles. I can strap them to my wrists, or I can just use it as a hand weight. And same thing, I can do some of these exercises utilizing these weights. So it's very easy to find things at home that you can use if you do not currently have weights. If you have weights, awesome. Make sure that they are not too heavy. Ideally, you would have, hopefully, like a set of 2 and a set of 5 is probably plenty for a lot of people. So let's get started. I always recommend, if you're going to be working out at home, that you do active exercises to get going before you do any weightlifting, and then you do your stretching after. So what is an active exercise? That could be going for a walk. That could be doing some squats. And those can be something simple. If you have a chair at home, or if you're doing these following along, I'll use our table. So if you're going to do a squat, we want our feet about shoulder width apart. So like this, I don't want to try to squat like this. I also don't need to squat this way. So we'll keep it nice and simple, about shoulder width apart. And then if I'm going to do my squat, I'm just going to take my butt down. My butt should be engaged the whole time. So I'm going to squat down as far as is comfortable for you. This may be enough. If you can get further, great. If you can get down, terrific. And we're going to come back up. So that looks like this. And we're going to come down and just touch our chair and come back up. And that's plenty. If that's too much, anybody have one of these at home? So we've got physio balls at home, hopefully, maybe some of you. And you can take that. We're going to bring this up just a little. Find an empty wall in your house. Press yourself against the ball and start to do a little bit of a squat. And your arms can be whatever's most comfortable for you. And I'm doing the same thing. I'm pressing up through my heels, and I'm pressing back against that ball. But you go down however is most comfortable for you. But that is a nice warm up to get things moving, to get our blood moving. We can do rotational exercises to start to warm up. We can do shoulder touches, start getting a little bit of blood moving in those shoulders. We can raise the arms up above the head. And again, for some of you, if you're not doing anything right now, that may be enough. But if we're gonna do some of our resistance bands, and these can be done while you're watching TV, these can be done at set times if this is your warm up for your morning, awesome. So we'll start with a little shoulder exercise. The other thing you can do if you only have one band at home and it doesn't appear to be enough resistance for you, if you hold it closer together, that's gonna give me more resistance than if I hold it further apart, okay? So what I'm gonna do is I'm gonna start with my green band. Maybe this, I didn't realize both of these were tied in knots. So let's start with blue. I'm gonna be a little adventurous this morning. And I'm gonna hold my shoulder. My wrist is straight out from my shoulder. And I'm gonna hold the band about shoulder width apart. Again, if you need more resistance, you come in. If it's a little bit too much for you, you can start a little further out. And I'm just gonna open up. So what I'm doing here is opening as far as is comfortable for me. And again, under normal circumstances, I'm gonna do 3 sets of 10 of these. And you'll notice I'm sitting on the ground. You could be sitting in a chair. You could be sitting on your bed. You wanna make sure that your chest is up to the sky, that your scapula, those little bones on the back, are sunk down. Pretend like you got little pockets and you're sticking those scapula in your pockets. You don't want to be rolled over doing this. You want to be nice and tall. And we'll do 10 of those. And it should come straight across the chest. Nice and easy. Good. So the next thing that we can do for the arms was similar to what I was doing before. And that exercise that we were doing, that's great for the back. You can also do rows for the back. So if you're able to anchor this, so what I'll do is I'm gonna take a 10-pound weight. I'm gonna anchor it. And what does that mean? That may be for you, that may mean that you tie it to a doorknob. Some of my patients will actually install an eye hook and they'll use that. It looks like my assistant is possibly joining us. But what you'll do is then you will pull, again, our upper body is gonna be the same for all of these. Shoulders are gonna be nice and relaxed and down. Heart is gonna be to the sky. So if we're rowing, we're just gonna have that traction and we're gonna pull towards us. We're gonna be squeezing those shoulder blades together. Nice and tight, okay. So the next thing we'll do is everybody's favorite, and that's a bicep curl. So same thing, you're gonna wanna have this anchored, or what you could do is you could step on it. So we'll see if this band that I have is long enough. Usually they come in a few feet of length, but I'm gonna show you what's going on down here. I'm gonna step on it and anchor it. So see if I pull, it doesn't move. And then I'm just gonna work on curling my bicep up. So again, we're focusing right here. And we're gonna bring that up. And if that's not enough resistance for me, I'm gonna grab closer to where I've got it anchored, reset myself, and do a little bit more. And if that's too much resistance, I'm gonna grab the end here and pull up. Does that make sense for everybody? We can also do the same thing, but for our tricep. So we'll step on it again and we'll get all set. This one, I want you to tip forward just a little bit. Core is nice and strong still, but we're working here. So we're going to press back. So I'm really engaging back here and I'm just kicking back. So nothing is moving here except the elbow. Perfect. And same thing, if that's not enough, you grab closer to the bottom. And if that's too much, you grab up toward the end. And of course, you want to be doing both sides. If you have hand weights at home, let's grab those. We'll show you what those would look like. So we'll be doing the same thing if we're doing our kickbacks. We're just going to kick back with that hand weight, or if we're using a can or something else that's weighted. You see what's comfortable for you. You might want to do it this way. You can hang on to it from the side, whatever works best. And then same thing for our biceps. We're going to curl that elbow up, or if we're using our hand weight, same thing. Nice and strong. Perfect. And again, all of those can be done sitting on the couch. They can be done sitting on the floor. They can be done on your physio ball, whatever is most comfortable for you right now. If you are on the physio ball, that is going to engage the core. So that's going to be a little bit more work. And then I also wanted to talk a little bit about leg work. So we have a couple minutes left. So let's do, and again, these can be done seated. I'll show you. I will do them on the bench. They can be done laying down, whatever is easiest for you. So what I'm going to do is I'm going to take my band that I have tied in a circle. I'm going to put it around both of my feet. And I'm going to keep one leg stationary, and I'm just going to bring this leg toward you. So I'm working the outside of my leg. So let's see if we can see that a little better here. My left leg is not moving. And this one that's coming towards you, I'm just bringing it out. And if that's not enough resistance, then you tie your circle smaller, and that'll be more challenging. Or if it's too hard, then you just make the beginning circle bigger. Nice and simple. You can also do the same thing, but keep one leg down and you kick toward the ceiling. That's working your quad, the leg up on top. And as always, you want to make sure that you're doing both legs at home. For timing purposes, we're just doing one right now. And then we can also, we'll see if we can do this one. Perfect. Okay. So we can also do some work on our hamstring and the butt. You'll notice that I put, instead of it being around both ankles, I kept my band around my left ankle. And then this one is around my foot. If you can see that, it's hard to see with the yellow ball in the background. But then all I'm going to do is I'm going to kick straight up. And it's a very small movement. Does that make sense for everybody? We are kicking straight up. Perfect. Okay. And again, those will be a little bit harder. If all you have at your disposal are free weights, those are going to be a little bit more challenging. They're best done with resistance bands. And you want to take a look at the type of band that you have. Those, we actually have a considerable number at the office because we buy them in big rolls. And then we cut them for patients. So if you are looking for something to utilize at home, please feel free to send me a message. I believe that they run somewhere in the area of like $6 for a, I think that it's a 3-foot length. So it's a pretty, maybe this is 6 feet. Pretty considerable amount. And you can do quite a bit with that. So if you are needing something to utilize at home, we do have these lengths available in the office, and they are not marked up due to the stay-at-home order. You are able to pick them up in the office, or of course, if we need to ship them, we can ship them. There is a nominal shipping fee. So if you enjoyed this, and I know we went really quickly, but Demi and I are going to start doing more structured programs. This is what I teach in my office. It's called Stand Taller, Live Longer. I do sell the books, and it is a 10 minutes a day to keep you active, keep you pain-free. It's a wonderful adjunct to the work that you're doing at Osteostrong, because this practice actually really focuses on core strength and stabilization. So if that sounds good, stay tuned for more of the videos. And as always, we're gonna wrap it up here with a couple questions. If there's anything I can answer, let me know. It looks like we had a comment on Facebook. It looks hard. It's harder than it looks.
Yeah, that's what I was going to say. I've been watching Facebook. I think we're good today on questions.
Yep. Awesome.
All right, everybody. I hope you guys catch the replay and enjoy this. Write any comments, questions. We'll check back later. And I want to check that book out, Jordan. That looks good.
It's very cool, and it's nice. It has a terrific introduction, and then it goes through what I like, of course. It talks about the why. So it talks a lot about cardiovascular health based on posture and things like that. It has some pictures of people. It asks you to pick out their age. And we often associate, you know, like a poor, rounded posture with an older individual, you know, but now these days, everybody's on their phone, everybody's on their computer doing that poor posture. So there may be, you know, a 25-year-old with really poor posture, and then you've got an 85-year-old that's just rocking this great, you know, great posture because they've been active and they've been paying attention to their core and their muscles. So that's what we hope to teach, so that nobody can pick out your age based on how you look. That's our goal.
We'll be young forever.
I like it. I like it. Awesome. Well, thanks for tuning in. Thanks for your patience with a little bit of the video back and forth, and we will see you all next week.
Bye, everybody.
Bye-bye.